మీ పిల్లలు ఫారెన్లో చదవాలనేది మీ కల? మీ కలను నిజం చేసే ఏకైక సంస్థ విదేశ్ కన్సల్ట్స్.
Well, welcome, sir, in Hyderabad city. Is it your first visit, or you've been coming and interacting with the people
Definitely
in India?
my first visit to Hyderabad. And
Okay.
and I should have come earlier, but during the pandemic, it was difficult. But because of this wonderful collaboration that we've had with Mahima Datla and BioE, Biological E, and now with AIG, there are lots of reasons to continue coming. I think one of the things that we're hoping is that the success we've had collaborating on the production and distribution of Corbevax that reached 100 million people in India, how do we keep that going? I don't want that to be a one-off thing, right? I'd like this to continue. And so today we talked about some of the other vaccines that we're working on could possibly collaborate with BioE.
And you've been into vaccination. It's very important. The day a baby is born, the life is started with a vaccination, right? We are given a report card that
Right.
from the day baby is born till 17 years, you need to follow your vaccination.
That's right.
How you see that phenomenal, card like from baby born and then it's go till 17 years. Do you think after that also the vaccination that you guys are talking on, a certain age is required where vaccination is gone?
Well, I think
Need to work on, because recently we're seeing more of the new diseases are coming up.
Well, that's right. I mean, I think most of our new vaccines are more for child health. And Corbevax was primarily given to adolescents 12 to 14, as our hookworm vaccine would be given to younger children, maybe alongside the measles vaccine. But I think one of the items that we spoke about today is the fact we're seeing more and more adult immunizations. And now in the United States, for instance, we're not only giving COVID vaccines and flu vaccines, influenza vaccines, but also Shingrix for shingles, or respiratory syncytial virus, RSV vaccines, or pneumococcal vaccines. So that's 5 new adult immunizations that we haven't given before.
What's the right ages to be given these kind of vaccinations?
It varies. In some cases for pregnant women. In other cases it's for seniors, for those over the age of 60 or 65. But I think there's going to be an education process for the internist and the obstetricians, because I was trained in pediatrics, and during my pediatric clinical training, vaccines were front and center of the training as a bread and butter component of pediatric training. Not so much on adult medicine, but I think that's got to change because we're seeing so many new
And when
adult
in India
immunizations.
that COVID comes, so people used to have this news that children are safe till 5 years, like from 10 years they are safe. The COVID not going to affect them. How you take this? Like,
Well, we know it's not true. In fact, and there's that similar kind of sentiment in many parts of the United States, particularly because we have a very strong anti-vaccine lobby, where they draw a line in the sand. They say no COVID vaccines for children.
Yes.
I'm saying I disagree, because COVID is still a leading cause of death among children. In the United States and elsewhere. We don't have good numbers globally, but it's probably in the tens of thousands. That's point one, causing hospitalizations. But there's 2 other things going on with COVID in children. One of them is what's called long COVID, post-acute sequelae, brain fog, exercise intolerance, and some estimates coming out of the London Children's Hospital at Great Ormond Street show maybe as many as 1 in 7 kids with COVID develop long-lasting COVID symptoms. So that's something to
that's
consider.
a myth, I think.
So vaccination, because long COVID can occur after any COVID case, but it's more likely to occur after severe COVID. So by vaccinating to reduce severe COVID, you may have the added benefit of preventing long COVID, and nobody talks about that. So
Yes.
that's important. The other very interesting finding now is there's some evidence that COVID is associated with diabetes type 1. That if you're a child that gets COVID, you're more likely to get diabetes type 1.
okay.
Now, we don't have the evidence showing vaccination will protect that, but I think it's something that we have to take seriously as well. So I think, people who have an agenda, who want to discredit vaccines, will point to the overall low numbers of deaths in kids, and that's true, but it's still significant. It's still a lead. COVID kills more children than influenza does, and we vaccinate against influenza, but also the long COVID and the diabetes, I think is something
And
that
you
we
were
have to
just
take
talking about
seriously.
boosters. If we talk about influencers, we are giving to the kids. So do you think any right age is there? Like it should start with the child is born?
For COVID.
Yeah, for COVID, because now the situation is totally different.
Well, I think it's going to depend on what happens with COVID in the coming months and years. You know, is this current wave the last gasp of COVID? We always want to hope so, but I don't know that we have the evidence for it yet. But here's something that's important to consider. Remember, COVID is our third major coronavirus epidemic or pandemic in this new century. We had SARS, severe acute respiratory syndrome, that arose out of southern China in 2002. It affected Toronto, Canada. We had Middle Eastern respiratory syndrome, MERS, that arose out of the Arabian Peninsula and affected Korea in 2012. COVID-19 is the third one, and that was the most significant of all in terms of number of people affected. My guess is we're going to have a fourth major coronavirus before the end of this decade.
Oh.
And why is that happening? Why are we getting this regular cadence of coronavirus infections? And I think it's a combination of 21st century forces. I think climate change is a big one. You might say, well, what does climate change have to do with a respiratory virus? Well, these viruses, coronaviruses, as well as Ebola, originate in bats. And that's the original animal that's getting infected. And now what's happening with climate change is it's altering the bat food habitats. Okay. So bats are migrating to new places that they never migrated before, including coming into closer contact with people. So that's happening. Also, you've got more deforestation, more urbanizations going on for the first time.
Yes.
On our planet, more people live in urban environments and rural environments. So I still think what you're seeing is this kind of confluence of 21st century forces that are driving this, what I call a regular cadence of regular pandemics from Ebola virus and coronavirus.
But there was just you were saying about that every 6-7 years there is a weather change, or the coronavirus waves change. It's like a wave.
Yeah.
What do you say now? It was the first wave or second wave, and now third wave yet to come.
That's right. Well, COVID is the third, because we had SARS, then MERS. The other name for COVID is SARS-2.
It's like
we're going to have SARS-3 or SARS-4, and
it's like what the gap
and exactly where will it come from? Whether it'll come from China again or Southeast Asia. The studies that we know right now is that when you sample bats across the face of Asia, thousands of people every day are getting infected with new coronaviruses.
Oh.
And then every now and then, one of them, for reasons that we don't entirely understand, kind of ignites and catches fire and spreads as an epidemic.
So there is a gap of 5-6 years, sir?
That's what's happened so far.
Because we finish every 5-6 years, we need to get ready for that, right?
We may have to. Well, we had SARS. It's like predicting an earthquake. You can't predict it exactly, right? But we had SARS in 2002, MERS in 2012, COVID-19 in 2019. So every 6-7 years, that would say before the end of this decade, we may have another one.
Okay, the next wave to come, it's like third wave. We need to get prepared
for
that.
The fourth wave, actually.
Fourth wave.
But the good news is, if you have to look at pandemic preparedness, India is better prepared than most. Why? Because of the sophistication, the depth, the breadth of the vaccine industry. BioE, of course, here in Hyderabad and Bharat, but also, Serum Institute and so many others. This is something very special. I spoke at a government agency yesterday, Barack, about this, and I said, vaccines are India's gift to the world. I mean, this because no other country is producing quality vaccines.
That's a great compliment. We should appreciate that.
At the level. And when I was going on TV a lot during the COVID pandemic, and I did several Indian TV interviews, I'd make sure I'd said that every time.
Thank you so much for that compliment.
And it's heartfelt. Yeah, thank you.
And as you talk about the India, what do you see the immunity system as compared to the people who are in other countries? Immunity-wise, if we talk about in India, we have more immunity. Do you think so?
You had that horror before vaccines became available. You had that horrible Delta wave where a significant percentage of the country got infected. I think the problem with natural immunity from infection, it does occur, but it's ephemeral. It doesn't hold up as well unless you get vaccinated on top of it. So exactly how durable that immunity from natural infection will be is something I think we can't rely on, and we don't understand why.
And there was a myth going on. We lost so many young people. They were getting heart attacks. Then there is the news coming up because of the vaccination. It's getting affected. How true it is? How you clarify that?
It's not the vaccine. The vaccines are safe. I think the issue is when COVID first struck, we thought of it like the previous two coronavirus infections, SARS and MERS, which were primarily respiratory viruses. COVID-19 is a respiratory virus, but it's so much more than that. Why? Because it's causing thromboembolic events. True. So the virus is going into atherogenic plaques in coronary arteries and causing heart attacks. causing strokes. And that is something that is not well understood. So getting vaccinated is an important way to protect your heart health.
So I think
And that's also true of influenza vaccines as well.
so. Boosters and influenza. What is the right age? Like now, we have already taken that. So
Well-
every 6 months or 1
remember
year,
now
it has
that-
to
well-
go like a flow chart.
Well, remember the virus has changed now, and the XBB, the new XBB variants are quite different from the
Yeah.
original lineage. So now we're partnering with BioE to make the XBB booster. So that's finishing clinical
So what
trials, and I'm hoping in the next couple of months we
we
might
can
that.
have a victory on
I
that.
hope so.
So
I
what
hope so.
precaution you would like to take for like to make ourselves healthy and to fight with these all diseases? What do you have to say about
I
that?
think one is having situational awareness. Know what's happening with virus transmission in your community. And if it's going up and vaccine boosters are available for whatever disease, get that booster.
At any age, there's no
Yeah,
fixed age.
that's right. And masks are always a good barrier protection. But it's incumbent on you as an individual or as the head of your family to know what's going on in your community.
And COVID vaccine, I think they are safe for the kids. Like we should start giving it in India. Like, is there any news?
Well,
for like
this current XBB,
before 10 years or 11 years, yeah.
So Corbevax was the primary immunization used in 12 to 14-year-olds,
Yeah.
as well as for primary immunization, as well as adult boosters. The XBB boosters being tested on the same population, and in addition also younger kids as well. So maybe that will become.
So in the
available.
next wave, I think kids can get affected and there will be a vaccination for them also. We can hope for that.
That's the hope, yeah.
That's a hope. So I think we should be not having this myth that kids cannot get. I think we need to take precautions on the vaccination part for the kids also, right?
I totally agree.
You agree with that. Thank you so much, sir.
Well, of
talking
course,
to
I'm a
us.
pediatric vaccine scientist, so,
Yeah.
so what do you expect?
Vaccination is a big world. I mean, we are living in that. So, because the gap comes after your 17 years, we don't follow up much.
Yeah,
Once some diseases come, then we go
That's
ahead
right, and I
further.
think we're going to start seeing more adult immunizations.
Yeah, the board
become
has to
available.
start, I think, from 25, 35 years. We should
And
have
it-
the
and it's-
vaccination
and
board.
it's starting to happen.
Yeah, I think something is missing. What do you say about that?
I think we're going to see a new adult vaccination ecosystem form.
And the report card.
because now you've got Shingrix for shingles, Prevnar for pneumococcal disease. You've got the new RSV vaccine that's come online in the United States, influenza, COVID. So that's already 5 adult immunizations that we haven't had previously. And by the way, I've gotten them all. So
Okay, that's great. So boosters and influenza, they are safest. I mean, you make them safe.
annual immunizations, absolutely. And
At any age, yeah.
and it's almost not even just a booster, because remember, the influenza virus changes dramatically its genetic makeup. So it's a new vaccine made every year. There's a carefully orchestrated dance that goes in to do the surveillance for the new influenza virus that's emerging every year.
So what are just I want to end up by knowing we talk about COVID. That was actually a very disturbing year for all of us. So on what segment do you want to work on it that the vaccination is more important? Where we are missing, like on the gastrology part or the other segments?
Well, today I spoke about one of our new vaccines for hookworm anemia,
Yes.
which is a big problem in India, as well as all of South Asia and on the African continent. And this is one I've been working on since I was an MD PhD student 40 years ago. And now we showed evidence that it's highly protective. So one of the reasons that I'm here in India with my science partner, Dr. Hotez, is to raise awareness about the possibility of a hookworm anemia vaccine and to see if we can do that with, again, the big Indian vaccine
with the
producers.
collaboration of this hospital, AIG.
Absolutely.
Yeah.
I mean, what could be better than having a
Yes,
gastroenterology
yes,
hospital?
yes.
Something
And
called
the-
the Asian Institute of Gastroenterology.
And working
it's
with
made,
the great
it's
doctors.
made for hookworm,
Yes.
right?
Yeah. Thank you so much, sir, talking
Thank
to us.
you. It was a real honor.
It was
Real
great
honor.
knowledge for us, and welcome again. And keep coming to India, and that's thanks to us, sir, AIG, and he's a very big doctor of our. He's a proud of India.
As you
Thank
should,
you.
as you should
We should
be.
thanks to him that he brought you here.
Thank you.
So much of great knowledge and awareness you shared with us. Thank
Thank
you,
you.
sir.
Thank you so
Thank you
much.
for coming, India.